Hi everybody, I'm Dr. David Morwood. I'm a board-certified plastic surgeon here in beautiful Monterey, California. Today I'm in our Revitalescence Medical Spa, again here in Monterey, California. I'm one of the 3 medical directors. It's myself, Dr. David Morwood, and here is a magazine article about Dr. Matt Romans, and it's actually featuring another laser treatment, removing tattoos. And here is our 3rd medical director, Dr. Jeremy Silk. So it's the 3 of us. We're lucky that we have 2 campuses, one in Salinas, Revitalescence Salinas, as I said, and here we have the Monterey campus of Revitalescence Medical Spa. We're very lucky that we have terrific nurse injectors. We have Shenna, who's a genius. We have our terrific Melissa. We have Lori, our wonderful receptionist. Today we're going to feature some laser treatment. Melissa is going to administer a pro-fractional laser treatment, and the goal will be to minimize some acne scars, do some skin tightening and refreshing of the skin. Now everybody, please keep in mind that lasers have many different uses and many different functions. There are many different lasers. Some lasers, as we see here, can lighten and remove tattoos. We have lasers that can minimize hair. We have lasers that can treat dyspigmentation, like liver spots, age spots. We have lasers to minimize fine lines and wrinkles. We have lasers that can help do mini tightening of the skin. So it's very important that we customize the approach. You've heard me use that phrase before, custom designed approach. We need to match the precise laser treatment for exactly the issue, exactly what you're trying to change or fix. And so it's very important, I think, that we take our time in consultation. You'll sit with our wonderful nurse injectors. One of the 3 medical directors is available to discuss what's the best treatment for you. And so I think that's a very important key education point, the right laser treatment for the right problem. Here at Revitalescence Medical Spa, we also offer cool sculpting. Our wonderful nurse injectors can do Botox and fillers, and so I would suggest you can make an appointment for a courtesy consultation, right, Lori?
Absolutely.
You can have a skin analysis and come on and meet our nurse injectors. I'd like to give you the number here in Monterey, Revitalescence, 831-290-1895. Again, 290-1895, revitalescence.com. And in Salinas, 422-7546, 422-7546. What we're going to do now is take a mini break. We're going to go into the laser treatment room and we're going to watch Melissa and Shenna administer a pro-fractional laser treatment for Ashika's face. She's already had 1 treatment because of some acne scarring. She's had a really nice improvement. Far fewer kind of pits and scars. I think she's had a nice improvement, and she's scheduled now for her 2nd pro-fractional laser treatment to improve her skin texture. Excellent. Ashika, how do you feel?
Great.
How was the comfort level?
About a 2 out of 10.
It was tolerable.
Very.
Awesome.
The fractional treatment is complete. It took about 4 to 5 minutes to do, and we specifically did her lower face, working on the acne scarring. We are now applying Aquaphor to the face. She does have some pinpoint bleeding in some areas, which is perfectly normal and safe. The instructions that our patient is going to do now is to just put this on for about 4 to 5 days, and really being aware of when she has direct sunlight and indirect sunlight. If she works near an office window, if she's driving for more than 15 minutes, or if she's outside, she wants to put that sunscreen on with Sciton titanium. Otherwise, the Aquaphor will keep her moisturized and comfortable, and she should have a painless recovery.
Hello, my name is Ashika. I am a patient over here at Monterey Revitalizing Center. I just had my fractional treatment done. I had a treatment done about 6 weeks ago. I had great results from it, so I wanted to come back and get a second treatment done. I was numb prior to the procedure with a numbing cream for about 20 to 25 minutes. Doing my procedure, my pain level was 2 out of 10, and it went smoothly. The procedure probably lasted about 10 minutes with the laser, and I'm about 5 minutes out from my procedure. I do have some pinpoint bleeding on my face, which is absolutely normal and to be expected. I will be using Aquaphor for about 3 to 4 days after, and I'll be applying sunscreen for the next 2 weeks and trying to stay out of the sun for the next 2 weeks.
So thanks for talking to us this morning. So you had some fractional treatment, laser treatment for acne scarring about 8 months ago, right?
Correct.
And we've seen your results. You got a nice result.
Oh yes, I'm very happy.
Excellent. And then you did some follow-up, another treatment about 2 months ago, wasn't it?
Correct.
Okay, how did that go for you?
It went great. I had a really great recovery. I stayed out of the sun for about a week or so, and I'm still getting results right now.
Okay, so you're getting some improvement. Now, I think with the fractional, you don't get all the improvement, the final result, like right away, like the next week. It takes a while.
It does. I'm still getting results as we're talking right now. I'm still getting results. It's just I can see my skin getting better and better each week.
Excellent. So you've gotten some improvement.
Yes.
Excellent. So that's fractional laser treatment for acne scarring. Ashika, thanks so much for talking to us.
You're most welcome.
What we've seen today is a great example of a fractional laser treatment for acne scarring. In this particular patient, we watched Melissa administer a fractional laser treatment for acne scarring. It's her follow-up treatment. She had a prior laser treatment, fractional laser treatment for acne scarring, and she had a good result. She got a really significant amount of improvement, and she did not experience PIH, or post-inflammatory hyperpigmentation. That's a really key point. Here's a great educational opportunity I want to discuss. I want to discuss PIH, and I want to discuss a related topic, and that's the Fitzpatrick scale of grading skin. First of all, what about laser treatment? What about chemical peels, TCA peels that I do, strong TCA peels, croton oil phenol peels? I think the best way to get ready for a peel and the best way to improve your chances of having a successful laser treatment is to prime up your skin. Get your skin ready. It's a lot like running a marathon. If you want to be successful at a marathon, you need to prepare and train. That way there's less chance of you getting injured. You're going to have a better result, finish the race faster, and recover more quickly. It's the same with chemical peel and laser. Prime up your skin. Retin-A, hydroquinone, other types of tyrosinase inhibitors. We can prescribe those for you and get your skin ready. In her particular example, she had a nice result before and after, and she avoided that PIH, post-inflammatory hyperpigmentation. Let me talk a little bit more about that. PIH occurs in certain ethnicities, certain skin shades after any type of injury or inflammation. chronic exposure to the sun, an abrasion, a scrape, sometimes a blemish or pimple, you may notice that in the ensuing weeks of healing, the body lays down more melanin and you'll see a brownish patch or hyperpigmentation, irregular pigment to the skin. That's a type of post-inflammatory hyperpigmentation. And we want to minimize that incidence, especially in certain ethnic groups, in certain shades of skin. So we want to help you prime up your skin, have a better result, recover more quickly, and avoid PIH. And there are ways we can do that. The second related issue I want to talk about is the Fitzpatrick scale. The Fitzpatrick scale is a way that we grade skin according to the amount of pigment in the skin and how you will react to exposure to the sun. Grade 1 comes from those people from northern Scandinavia, blonde, fair skin, blue-eyed, sometimes the redheads. They always get red with exposure to the sun. It's very difficult for them to tan. All the way to grade 6, African skin, very brown, very black. That type of skin does not burn. They don't really tan. Most people are in the middle, from grade 2 to grade 5. Those groups, certain ethnicities, Asian skin, certain Hispanic skin, Italian-esque skin. It's those shades in the middle that we're most concerned with post-inflammatory hyperpigmentation. We need to pay close attention to getting those people primed up for their laser or their chemical peel to improve their result, for a more quick, rapid recovery, and to minimize their chance of post-inflammatory hyperpigmentation. Again, there are many different regimens, tyrosinase inhibitors, hydroquinone, retin-A, etc. But your best result from a skin treatment will be if your skin is first primed up. If you would like any more information about peels or laser, I hope you'll look up Revitalescence Medical Spa and Laser Center here in Monterey. We have a Salinas branch, or call my office at 831-646-8661. I very much appreciate your attention and thanks for viewing.